Welcome to the Oxygen Alliance YouTube channel, where we bring you videos on installation, maintenance, and various trainings on oxygen equipment and devices. If you have comments and/or questions, drop them in the comment section below or write to us info@oxygenalliance.org. Remember to like our videos, subscribe to our channel, and hit the notification bell.
Hello, everyone. Welcome, and thank you for joining us for today's partner talk, brought to you by the Oxygen Alliance. My name is Oxygen Kunda. I'm a biomedical engineer for the Oxygen Alliance, and I'm very excited to be your host today. I am hosting the call from Lilongwe, Malawi, and I would like to know where you're joining us from. So feel free to type in your name and your location in the chat. If you'd also like to be added to our emailing list, get notifications of all the upcoming events by the Oxygen Alliance, you can also type your email in the chat. For some of you already know, recently the Oxygen Alliance launched the BME Konza app, which is an Android application that is designed specifically for biomedical engineers and technicians. The app serves as a resource hub and for providing access to maintenance manuals, instruction videos of various medical equipment. Additionally, the app also features a community for different engineers. So you have expert engineers and also a team of the Oxygen Alliance engineers that contribute to sharing knowledge on this group. So you can access the app by downloading it on Google Play Store. So make sure you go and download the app and check it out. Your feedback is very important to us, so feel free to share your thoughts and suggestions by reaching out to help desk at oxygenalliance.org. We appreciate your input as we continue improving the app for the biomedical engineering community. So the link and the email will be shared in the chat. So just go ahead and click the link to download the app. And also if you have any feedback, you can use the email to send us the feedback. So today we have a very informative presentation from the Oxygen CoLab team. They'll be presenting on the Oxygen Concentrator Directory. Our presenters for today are Rita McIntyre, who's the Innovation Program Manager at Oxygen CoLab. We have Miranda Dixon, who's the Strategy and Engagement Lead. And we also have Bonnette, who's the Senior Program Officer. So as you can see, it's a big team, and the presentation is going to be informative. So I'm excited to have everyone on this call today, and I encourage everyone to take notes as we look forward to hearing your questions and comments at the end of the presentation. So without taking much of the time, I will hand it over to our presenters. I don't know who is going first. All right, Miranda, yes. So over to you, Miranda. Thank you.
Thank you, Aubrey. That was a lovely introduction. I really appreciate it. And I also want to say that I've already been on the Conzo app, and I think it's a really, really brilliant initiative. So really congratulations on launching that. And yeah, I'm so excited to see where it goes next and encourage everyone to get on there because it's a great resource. I'm going to present my screen and do start off with a bit of an introduction to the Oxygen CoLab, just to set the scene a little bit. So hopefully you can see my full screen there. Let me know if not. And this is really a collaboration today, brilliant, between myself, Miranda, who works at Brink, and we're in consortium with DT Global, where Rita's from, and Brad joins us from ECRI, who's our collaborating partner on the Oxygen Concentrator Directory. And this has all been funded by the UK government development funding, which we're very privileged to receive. And to give a bit of a sense of what we do, we emerged from COVID-19 and we realizing that the acute need has been around for a long time, but increasingly so, to make sure that there is access to oxygen in low resource settings. So we've been bringing people together kind of across the world to explore this problem, and most importantly, see how we can find solutions that are really bringing together the right mix of technology and services to expand access to oxygen in low resource settings. We do this in a few ways. We support product innovation, so that includes funding the development of fit-for-purpose concentrators, as well as lab testing that we're going to talk about today, but also supporting devices as well, so that we can really build a market where there is a full spectrum of brilliant technology and surrounding accessories that will ensure that we can maintain really good oxygen supply in low resource settings. We also know that technologies alone will not be enough. So we also support the development of oxygen as a service models. So essentially supporting businesses to build services where they can provide 24/7 oxygen supply and ensure that there is maintenance, training, servicing, and a whole package of services that are needed to keep an oxygen supply flowing. And then on top of all of that, we are really making sure and striving to ensure that these products and services are sustainable. So we work with evidence partners, we work with governments, ministries of health, to ensure that these models can be adopted where they are effective in a contextual way based on evidence. So we're really keen to make sure that it's clear what works where and that we can support the adoption of the right kinds of models in the right places. The clue is in the name. We are a CoLab, so this just gives you a sense of the number of different partners that we work with, and very privileged to do so, including, of course, the Oxygen Alliance. And just to kind of set the scene as well, since 2022, I'm sure you're all aware that there's been huge progress when it comes to product innovation, when it comes to oxygen concentrators in particular. They've always been seen as effective devices for use in low resource settings due to the fact that they're portable and that they can be easily moved around and kind of put in those places where there isn't any oxygen supply. But there has been a number of issues which has meant that we haven't really seen their full potential. This led to a huge development in the kind of technical development in oxygen concentrators, so that this year we're seeing the first ever fit for purpose concentrator for low resource settings hitting the market and being distributed across the world. We've seen a huge amount of increased collaboration between oxygen experts to understand the limits of technology and surrounding oxygen concentrators and a kind of much better understanding of what's needed to make them more fit for purpose. From that, there was a target product profile developed for oxygen concentrators in low resource settings so that we really knew what needed to be done for them to really be effective and to be technically more proficient for use in low resource settings. And then that led to investment in that development towards them and an £8 million advance purchase commitment to make sure that they did actually hit the market and were bought and could be distributed across the world. So that's on the side of product development of oxygen concentrators themselves. But the other really important aspect, as I'm sure all of you are aware, is that there is already a current oxygen concentrator market that we can't forget about. This is a picture from a hospital I visited in northern Uganda, which shows, and I'd love to know in the chat if this is your experience too, that there are many back rooms in hospitals that are full of oxygen concentrators that are no longer working. And this is for a number of reasons, but can partly be partly known that it's due because they were largely designed for the global north. So it means that when you put them in settings where there might be very different very different levels of humidity, for example, or levels of dust, etc., they quickly break down. We also know that, of course, there are different contextual constraints in so many different areas. So there's not really one perfect concentrator. Different contexts need different things. And so it's really important that that is understood and designed for. But what we really wanted to do was to really understand a bit better of the current market of oxygen concentrators that exist at the moment. What are their strengths and weaknesses, and how do they perform against different contextual constraints that we know are common, such as safety, usability, repairability, electrical resilience, and energy efficiency as well, so that that decision makers can make evidence-based investment decisions on the oxygen equipment that they're going to buy. So that allows me to come on to the Oxygen Concentrator Directory, which is a response to this problem. And I'm going to hand over to Rita now to take us into what exactly this is and how we've got there.
Thank you, Miranda. So after 2 years of research, you're about to see what has come out of this, which is the Oxygen Concentrator Directory. Recognizing after COVID that the oxygen concentrators being sent around the world were typically not lasting very long, largely because they just weren't designed, as Miranda said, for the low and middle income settings. For example, you have high dust, energy volatility, and various other factors which put these units through more hardship, if you like, puts them to the test a lot more than they would do if they were just being used at home settings in the UK or North America, for example. So we used a secret shopper approach to purchase a number of different oxygen concentrator units from different manufacturers from different parts of the world, to bring them to a laboratory in Canada to test them against the UNICEF's TPP, so the Target Product Profile. And the UNICEF's TPP obviously lists out a number of criteria that oxygen concentrators should meet to be deemed suitable for use in low and middle income countries. So through using that criteria and working with our lab and other individual consultants who are experts in this field, we established a number of evaluation criteria against which we tested 11 different models of concentrators. The evaluation criteria on the screen were performance, safety, usability, repairability, electrical resilience, energy efficiency, and cost. When we move on to the next slide, it just summarizes the different audiences that we built this directory for. So throughout the testing and when we put the directory together, we know that this is designed for people who are procuring oxygen concentrators or who are advising on the procurement of such, to help them really understand what units have been put against this UNICEF TPP in testing and which units come out the best. So, for example, ministries of health might have a different criteria to various NGOs or suppliers and distributors. By using the directory, you can click who you are, and it will help you come up with some of the criteria. But the criteria enables you to compare different models of oxygen concentrators. For example, if price is your criteria, you can say it's price. If getting up to 10 litres per minute was your criteria, you can put that in. Obviously, not everyone can afford to buy a concentrator that meets every single criteria, but it might be that one criteria is more important for you than another. So by using this directory, it also helps users to increase longevity of the concentrators that they use within their healthcare settings. And it also helps to, within the idea of the greater global good, to advocate for fit-for-purpose concentrators in low middle income settings. We're going to go into now, I'm going to start off and then hand over to Brad on some of the testing that we actually put these units through. Obviously, I get very excited by the detail, and know the audience on this call, you might also prefer to know some of the detail of the testing the units will put through. So the first one is my favorite, I think, because I can visualize it. It's the dust testing. Obviously, again, recognizing that in a number of contexts outside where these units were designed for, there's a lot more dust in the air than there is, for example, where I live in London in the UK. So we actually used a dust profile that is typically found in Malawi. and it represents the hard particles and sizes of dust particles that can affect compressor lives. We weighed the units before putting them into a dust chamber. We then created clouds of this dust to continuously throw the dust, if you like, at the concentrators for a period of 45 minutes. We then turned the concentrator off to allow the dust to settle. We then opened the door to allow the temperature of the concentrator to return back to its pre-testing temperature. And then we weighed the concentrator again at the end of the testing. This weighing allowed us to determine how much dust the concentrator had actually taken on board. And then at the end of all of this, we actually took the concentrators apart, and that enabled us to see how far within the concentrators the dust had got. So obviously these things don't like a lot of dust shoved at them for a long time. So a number of them did stop working. A number of them also stopped producing the 10 litres per minute. Some stopped and then restarted again. So it was really interesting to see how these units performed in dusty environments, and these feed into the directory, which you will see shortly. We are working to do field testing of these units, and further field testing will actually help bring these results to life in real life contexts. I'm going to hand over to Brad now to discuss more about the chamber itself and some of the testing that was done.
Yeah, thanks, Rita. So in addition to trying to understand how dust affects performance, we also wanted to understand how heat and humidity affected performance. And similarly to dust, we knew that these challenging conditions would reduce the performance for all the units, but we didn't expect it would reduce it the same way across the board, right? So the units that saw a smaller reduction in performance are going to do better in these challenging conditions. So in order to, for the dust, we use this dust chamber that has been used to do IP dust testing for a long time. But for heat and humidity, we had to be a little more creative. And we wanted, one of the key things is we wanted to be able to test all of the units at the same time to make sure that our testing was valid because they were all getting the exact same conditions. So most environmental, I don't know, maybe there's an environmental chamber on the market that meets those demands, but what the team in Canada decided to do was to build an environmental chamber out of a shipping container. So you can see sort of the inside what it looks like here, but this, if you can imagine, this is a massive shipping container that was repurposed for this use. It has these two shelves. So I think there's 10 units on each shelf, a total of 20 units, I think, in the chamber at once, 2 for each of the models we were testing, so we have some redundancy and some sort of a quality control to make sure we saw some aberration on this unit, but we had a second one, so we could compare it against the second unit. With the oxygen is being produced right from the unit, it's going out of the chamber through a hole, being measured, both the flow and the oxygen concentration that's coming back in to feed into the unit, and then the gas out of the bottom, where that's the higher nitrogen concentration is being cooled and then fed back in. It's very complicated. I wasn't involved in building it. I don't really understand all the things in there, but it took quite a bit of work to get it working, but they did eventually get it working. And it allows us to test these devices at 90% relative humidity. And I think, I forget the temperature. Anyway, very high temperatures and very high relative humidity for a long period of time. And part of the testing was, not just running the units at a steady state. We would turn them off, like physically turn off the power button, but also sometimes just cut the power. So this what we called an unplanned shutdown, where we would cut the power at the cord, which is very challenging for the units to deal with. And so we really put these units through their paces on this testing, and some of them just totally stopped working. Some of them you can see, I don't think we have pictures of it, but the actual plastic casing started to warp and melt because of the temperature they were exposed to. It was brutal testing for these devices. Yeah, right. And so this is just one example of one of the performance profiles that we did, where we would turn keep the temperature and humidity high, and then cycle the devices on and off, because that sort of on-off startup shutdown is really challenging for the devices. And so we were essentially trying to make them fail by doing the testing as challenging as possible. So this is again, there were 5 or 6 different test protocols that we used specifically related to heat and humidity in this environmental chamber. Here you can see at 95% relative humidity, 40 degrees C. And then so this stabilization period between again, there were other ones, but this is one of the tests that we did here. We can go to the next slide, Miranda. So one of the things that was really striking to me, and so these, as Miranda pointed out, you know, the devices prior to the development of fit for purpose concentrator, the devices that were used were primarily designed for not just use in the global north, but also in this home care, maybe long-term care setting. They weren't designed for use in an acute care setting. And in most situations, that carryover is fine, but there are some critical situations where the devices were lacking essential safety features, where the type of patient who would use this, you know, in a home where I live, they're not going to be that sick. And so if the device stops working for some reason, the chance that the patient's going to see a massive problem are pretty low. The biggest safety issue with oxygen concentrators in the use in the US is fire. Not that the device stops working and the patient dies. But if this patient is very sick and this is the primary source of oxygen for a very sick patient and the device stops working, obviously that's a much more serious issue. So in light of that, we looked at safety issues with these devices, and we had some serious findings. And there are two that I want to talk about. One is overdraw and the other is alarms. So overdraw is the term that we use for if you can turn the flow on the concentrator higher than the maximum specifications. So the units we looked at were 10 liters per minute, but the actual flow you could deliver if you turn the flow dial all the way up, and some was more than 20 liters a minute. But that doesn't mean you're getting more oxygen. The amount of oxygen it delivers is only enough to provide the correct concentration at 10 liters a minute. So anything above that maximum specification will actually dilute the oxygen being delivered to the patient, or if it's being split to two patients. So it is potentially very dangerous to deliver overdraw. And what we found was all but one unit allowed significant overdraw. And some of them, like I said, up to 20 liters a minute, double the specification. So this was a serious differentiator between the units. The other one is alarms. So many of the devices we looked at did not alarm for these key things like low oxygen concentration, which could be due to overdraw, but could be other situations. Could be, you know, degradation of performance because of exposure to heat, humidity, and dust. But also if the actual oxygen the tubing coming out or the cannula became occluded and the patient isn't getting any oxygen, the devices wouldn't alarm for that either. So these are critical alarms because in both cases, they could lead to serious patient harm. And we actually heard from some vendors that, oh, those alarms, the device has those alarms, they're just optional. The unit you bought through your secret shopper, it wasn't turned on, which is really surprising. And, you know, I have dealt with a lot of devices over my years of testing devices at ECRI, and I have never encountered critical alarms that are optional. So we wanted to make sure so we made sure in the directory that folks know these devices have optional alarms. They're really only safe to use if you make sure you get it configured with that alarm. And there are some that they just don't have the alarms. All right, so they got a massive disadvantage. You know, we really downrated them in safety for that reason. So this is a snapshot of the directory. Obviously, the directory is a live website. And what you'll see is, you know, there are 11 units, and for each unit you have a picture here, the name of the unit, the overall star rating, and then the rating in these different categories, and then some basic information about flow range and these symbols to indicate price. You know, pricing varies, so we didn't have super accurate pricing data, but we were able, you know, we know what we pay for them through our secret shopper, and we use that to give them essentially either a low or a high cost with these with the pound symbols there. In addition to sort of looking at all of the devices here at a sort of at a glance, you can filter the units to see, like, you know, this is or sort them, filter them according to the things that are most important to you. Oh, here we go, live view. And you can, if you're interested in the details on the unit, right, you can click on the read the report and you can get in and see all of the findings, the detailed findings we had for each unit. Yeah, so it's Miranda showing here. You can filter to show, you know, just sort of, it'll, you know, exclude units that don't meet these criteria. And then for any one of them, you can click on it and see the full report. And this is sort of all the nitty gritty of everything we found in our testing on these devices, why it got the rating, what issues it had. Yeah, so we're really proud of this work. One other thing I just want to make sure I say is, the reason to give the devices ratings is certainly to encourage folks to buy the devices with the higher ratings, right? So if you can just buy any device you want, get the device with the highest rating. But we also provide the information for you to make a decision if you don't agree with us, right? So, or the things, we rated, so for instance, we rated dust and humidity equally, but maybe you're in a situation, you're in a setting where dust is not particularly problematic, but humidity is really important to you. So you can, look at our findings and decide for yourself that, well, this unit did great in humidity, didn't do great at dust, but I'm not worried about dust. So I'm still going to consider this unit. So we wanted to provide the information for you to make those decisions on your own. And the other thing is we recognize that you might be limited in the options you have for whatever reason, but we still want to provide the information so you can say, oh, well, we know this unit has issues with alarms, so what do we need to put in a position to use it safely, knowing these limitations? I think that's all I've got.
I'm just gonna take us home, as it were, with a couple more notes. And the other thing I should also mention is that along with the reports for all of the concentrators that were tested, the research protocol that was used, we've also open sourced. So if anyone did want to repeat a similar exercise, you've essentially got a guide step by step to be able to do some testing yourself of other devices. So I want to finish by saying thank you very much for your time, and we're really excited to open this up for discussion because we're as interested to learn from everyone here as much as we're excited to share. We're particularly interested to understand where and how this resource might help you in your work, and how we can improve it as well. Where and how can we advocate for its use further, where and if it's useful. How can we support you to use this? Who should we be sharing it with? And of course, we're really happy to take questions about the process, any of the findings, and what happens next.
All right. I think before the questions come in, thank you very much to the Oxygen CoLab team. Just a reminder to everyone on the call, a form will be sent out just so you can get your feedback on the webinar, because we are constantly working to improve our webinars and our content. So when you see the form in the chat, the link, make sure you click on that and fill in the form so that it will help us to make sure that we deliver the right content for everyone. So at this time, we're going to take the questions on how the Oxygen CoLab, the Oxygen Concentrator Directory can help us as biomedical engineers.
All right, I feel like this information you've shared is very helpful and useful. And to make a greater impact, I think there is a need for engagement with the governments in the Global North and also donors and implementing partners. So I just want to find out what's the plan for engagement with these donors and also the government in the Global North. Because as much as this information is there, it may not be that much of use if these governments and donors are not contacted and they understand why you are doing this. So that's my question. Thank you.
Yeah, it's a really good question, and it's something that we're kind of continuing to work on. So we are a UK government funded program. So first of all, there's distribution we can do through our funder itself, and that kind of reaches to all of the kind of country offices, as it were, with lots of connections across the world. The other avenues is putting the resource as well on some of the key websites and repositories around kind of oxygen guidelines. So the Global Oxygen Alliance, for example, is one that we will be publishing these results on. And I think you're absolutely right. making sure as well that we can build connections in countries with, as Freddie has suggested in the chat, drug regulatory authorities and procurement agencies, etc., is really crucial. And I think that's also the reason why any connections you can share or introductions you can make for us, we'd really value. We are kind of, working through all of our different contacts as well and collaborators to make sure we reach the right people and have meaningful conversations. This is more than just an email. I think it's really about relationship building and understand how this kind of resource can be effective at the right time. So keen for any thoughts you have on that too.
Yeah. All right. Okay. Thank you for that answer. So I just wanted to say something to add more. So I manage a team of engineers that goes around the country in Malawi, maintaining and fixing oxygen concentrators under the OpenO2. So what we've observed is there are a lot of plans or models of oxygen concentrators. Some are resilient and they are good. Actually, you see, 2 years they are running with no issues, but some just a month old, you have problems. There are a lot of problems. So we are planning to hold a dissemination event just to share what we have found in the field over the years. And I was just thinking here that it could be a good platform to introduce the Oxygen Concentrator Directory to the stakeholders who will be involved, because donors and also the Malawi government will be invited to be there. I would like to see how we can collaborate actually on this moving forward. Sure. So, yep. Just want to...
Please, yes. So I think the two things about that just immediately, two immediate reactions to that. One is we crave real world data. We had this simulated environment, and there's lots of use for that, but there's no substitute for the real world data of how the devices do in the field. The other is, we didn't really talk about it, but we tried to understand and compare how easy it is to repair the devices, because we know there are going to be issues. So we did talk about this, but we did I just quickly, so in order to assess the repairability of the devices again, this is very high level, but it was something that we could do in a short amount of time and easily repeat from device to device. We essentially measured how long it took and sort of gauged the complexity to just take the cabinet panels off the device, then to remove the sieve beds and remove the compressor. Obviously there's more that you need to do when you repair them, much more than I do. And then putting it back together to take a lot longer than taking it apart. But even that simple thing of just taking the devices apart, we saw massive differences between the devices. Some took a few minutes, some took 30 minutes just to take the cabinet panels off, because there were so many screws and you had to have a long screwdriver with a really long neck to get in to access the screws. And there were two different sizes of screws, and you could get them, it's so complicated. Again, you know much better than I. But we did try to assess that, and that is one of the things that we capture in the directory.
Yeah, thank you very much, Chimwemwe, for that question. Just also adding on to that, part of the team working with Chimwemwe, so I also have experience working in the field with oxygen concentrators. So we have a lot of data, and I think maybe working together we would see what kind of data we can help you with, because as you said, we are constantly going to different facilities, especially here in Malawi, collecting data that is related to oxygen concentrators. Yeah, so I think there's a comment in the chat. I'll just read it out loud. From Kitutu Freddy. Share the resources with the drug regulatory authorities that often develop guidelines for granting marketing authorization to medical equipment. The second one is also share the resource with medical product procurement agencies at national level, and also share it with medical technology teams in ministries of health and health professional, in brackets, biomedical engineers and pharmacists. So I think that's a comment to how to make sure that people have access to the directory. There is a hand from Ali Khalid. Ali Khalid, you can go off mute and ask the question. Or if you can also use the chat if you have other questions. So Ali, go ahead and ask your question.
Yeah, hello everyone. My name is Ali Khalid, and I'm from Hatch Technologies, based here in Kenya. It's a non-profit organization, and we work with the Nest 360 program. You might have heard of it. It's very, very informative session. Thank you so much, the different presenters. Just wanted to share insights we've experienced with some of the oxygen concentrators, and we also actually do record some of the device issues that we receive, including the oxygen concentrators. Just to give context, we've actually, in the countries we work in, through the NEST program, we, I think, supplied over 400 oxygen concentrators, quite a number, most of it also in Malawi. The team in Malawi might know that, and the oxygen concentrators. So the NEST has a process which is also includes is a qualification process which also does heat and humidity testing in a lab. Also, it includes also usability testing. That has really helped us identify good quality devices. But there's one aspect which we noted with usage over time, that is real world scenarios whereby, for example, we noted the counter concentrators, when you use it over a long time, a year, 2 years, they develop things like the sieve beds leaking, starting to leak, and the zeolite coming out. I'm sure you've heard of those. So I just wanted to see how we can incorporate perhaps markets or real world scenarios or incidences that have been recorded or experiences, so that we can incorporate those experiences into the live testing that you do, so that we have that testing that is being done live. Then you incorporate maybe scenarios that have happened already, like historical data that has already happened that have been experienced in different countries. And actually, that's what we are doing as Hatch Technologies. Whenever we want to procure or start distributing new maternal and newborn health devices, we look at the NEST qualified devices, and also we incorporate the market historical data, the install base, the number of incidences reported. Are there any things that have been experienced by users, by local distributors? So I think it can really help to inform the whole process and give us resilient devices. Thank you.
So my answer is, we don't know yet, right? How do we share this? We haven't figured it out yet, but I'm desperate to get this information. So I can share my email address in the chat, and then we can just start that way, and we just make it up. We'll figure it out. But I think that I would have loved to have access to that data when we were starting this process, and we were trying to find other sources of this data. And given our time constraints, we had to go without it. But now that we're making these connections, we can figure out what data we have and see, like, do your experiences align with what we found? Great, that means we're probably on the right path. Or there's a device that we said didn't work well at all, but you find this working great, or vice versa. Then we kind of have to question the way we did it and figure out why there's a discrepancy. And I'm eager to dig in that and figure out what's going on. So I'm going to pop my email in the chat, and then anyone who has data or experiences like this they want to share. I don't know what it's going to look like, but we'll figure it out.
We're happy to share our experiences. We actually recording devices in a system, a web-based system, and we record any device issues that we receive. Actually, we're recording data now over 4 years in almost 8 countries now in Africa.
Amazing.
We'll be happy to share experiences here.
Thank you very much, Ali, for that question. And I think just to also add on that, since the Hatch Technologies organization has already been collecting data, I think they've been collecting the data for their use, but I think a collaboration between Hash Technologies and Oxygen CoLab, maybe they can collect more data just to, help out with either more testing or comparisons between the tests that were carried out in the chambers and the tests in the field. There was a comment in the chat. I'll just read it out loud just so everyone gets it. I think it's from Asante Chisa. The question was, are there any licensing or access restrictions for using the data from the directory? Is it accessible to everyone? And the answer is it's accessible to everyone. There are no restrictions. It has already been taken in the chat. So I see there are more hands. I think we have a hand from
Monica.
Monica. Yes, Monica, go ahead.
Thank you, and good afternoon, everyone, and thank you for the presentation. It's been very interesting to know more about your project, although, Bradley, we have already spoken, so thank you again for the presentation. So what I wanted to ask is, I know that this project, has funded some projects, some units, and so do you think, so it was developed, so some products have been developed with thanks to the grant, and of course with some specifications in mind. Do you think you will add disclaimer to that? Do you think it's important to add a disclaimer, or do you think it's not relevant to the purpose of the research?
Yeah, that's an interesting question. I think I'll let Miranda or Rita sort of speak more to the disclaimer part, but what I can say is I was really only involved on the testing side, and the units that you're talking about that were designed with some seed money or some purchase commitments that were designed specifically to meet the TPP. That was one of several units we looked at, and from my perspective, it just was another unit that we tested, and it did very, very well. And it's not surprising, that it did well, given that it was designed to meet the same criteria that we were using to test it. But they really hit the mark in one of the devices. There was another one that did pretty well, but it's kind of missing some other areas. So in terms of me as the one who was doing a lot of the testing, not most of it, and doing the building, the star ratings and all that sort of presentation of the findings, how it got there wasn't part of my assessment. And the unit that is on there is one of the units on there, the Vilbus unit. It does very well. I don't know about the disclaimers. Rita or Miranda, want to weigh in on that?
Well, I think actually you've made the point quite nicely, Brad, is that we brought you and ECRI in to be an independent consultant on this, so that the answers aren't biased in any way. So all of the testing was done anonymously, so that there wasn't any, you didn't know, Brad, which devices you were testing and where they'd come from and what models they were, to really make sure that this was as a scientific approach as possible in understanding how different units perform. So that is really aimed, Monica, to make this as independent and factual as possible. And I think the other thing that to remember is that even though one of the units has done very well, there are also has a bit of, at the moment, has a slightly prohibitive cost point. So I think the other thing that we're wanting to do is to aid decision making in terms of really helping people to understand, well, which units are going to be the best for that context and purpose. So this is how we're thinking about this.
Thank you very much. Thank you.
Yeah, thank you very much, Monica, for that question. So the link to the Oxygen directory will also be available on the BME Conza app. And yeah, the link for the app has been pasted in the chat, so you can go ahead and download the app and have access to the various oxygen concentrators, the manuals, and also the directory from the Oxygen CoLab. So
great. Well, thank you very much for having us. And as we've said a number of times, we'd love to hear from you. And we'll put our emails in the chat as well, and really look forward to hopefully having some follow-up conversations. And thank you for your time today.
thank you very much. All right, so the attendance form that I talked about earlier has been pasted in the chat for everyone. So access the form and give us the feedback on the webinars, the BME Konza. Even if you go to the Oxygen Alliance website and you have some feedback, send us the feedback. We're always looking to improve. And just also to add on the Oxygen directory from practical experience, I think since the various units, the oxygen concentrator units, have been tested against various various sections. So I think even when you're maintaining the units, you know that if let's say you're in a very dusty place, right, and you see that a certain unit is malfunctioning, by using the directory, you can also have an idea of where to start from. If you're in a dusty place and it's malfunctioning, you know that maybe dust is contributing to that. Even the same thing with the humidity and issues to do with the power ratings. Because I have a specific experience that I had in one of the districts here in Malawi, Sanje, which is at the southern part of Malawi. Usually the power there at the hospital is usually on the lower side. So some of the units were not able to function, so they'll just switch on and off. But then other units were able to function properly. So I think with the oxygen directory, you can be able to, have a strategic decision on what units you want to buy depending on the situation that you are in. So I just wanted to also add to that. I think it's a very good item and tool for most of the engineers out there. Yeah, I think, yes, go ahead.
Sorry, I didn't follow the protocol. Is it, I don't know what the procedures are afterwards, but is it possible to connect us with people on this call so we can send them directory and again reinforce if they know of any ministries or anyone within their countries they can connect us with?
Definitely, that's okay. I think, I think the Oxygen Alliance team will keep in touch, and anything that you need from this call, I think we're happy to help. Yeah, thank you. I think, I don't know if there are any more questions in the chat. You can go off mute and ask, also type in the chat if you have any more questions before we, seems like we do not have any questions. But yeah, thank you very much to the Oxygen CoLab team for that. Did I see a hand in the chat? Okay, but I saw a hand up. Yeah, thank you very much to the Oxygen CoLab team and for the wonderful and informative presentation. To all the engineers and everybody on this call, let's download the BME Konza app. Let's go to the website of the Oxygen CoLab and access the Oxygen Concentrator Directory and see how that is going to help us. So if you have any further questions specifically for the Oxygen Alliance, you can reach us at info@oxygenalliance.org. And thank you for attending this talk, and until next time, it's goodbye from me. Thank you.